Cancer, a word that probably touched every single one of us. Many forms of childhood cancer have gone from being a death sentence to a curable disease. With more children surviving, it has become increasingly clear that cancer and the subsequent treatments such as chemo or radiotherapy can have long-term negative effects that extend beyond physical problems, such as hair loss, pain, nausea, vomiting, and physical disability. Also, the harmful effects on brain development, causing problems with attention, memory, language, and of course, depression and anxiety. Childhood cancer is extremely stressful for the patient and for the whole family. Stress begins at the time of diagnosis, when families are confronted by the tremendous burden of understanding the disease, medical terms, and facing the possibility of the child loss at such a young age. Family life is disrupted by frequent hospital visits, overwhelming medical bills, and questionable future. And then there are the stressful and sometimes painful medical procedures. For further understanding, I gave a visit to one of the eldest centers in Alexandria that provided treatment and support for cancer kids for more than 30 years, which is the Oncology Pediatric Center at Sporting Student Hospital. It was an overwhelming experience, painful but valuable. Children with cancer are particularly vulnerable to malnutrition because they exhibit much more needs due to the disease itself and treatment. At the same time, poor nutritional status may be a contributing factor for decreased immune function, delayed wound healing, and prognosis. Adequate nutrition plays a decisive role on several clinical outcomes measures such as treatment response, quality of life, and cost of care. And of course, we couldn't deny such a great Egyptian foundation such as 57357 and the support they provide to cancer kids from everywhere, even from other countries. Diagnosis with cancer can be a hug shock to everyone in the family. Each person will be trying to deal with his own feelings. This can include shock, fear, anger, sadness, and disbelief. No matter what age a child is, a cancer diagnosis will have a big effect on them. Their life changes dramatically. Remember, every child is unique and will react and cope in his own way. Art therapy is a form of expressive therapy that uses creative activities such as drawing, painting, and sculpting to improve physical, mental, and emotional well-being. Art therapy is often used to reduce stress and anxiety, explore complex feelings, manage side effects, and improve quality of life. And finally, I couldn't neglect one of the most famous cancer survivors in Egypt, the one and only Zain Youssef, a real fighter that overcame the disease for many years and won at the end. His story turned the light on his parents and every parent who are told that his child has cancer. There may be moments when parents can feel numb and don't believe what is happening. Parents play a hug role in how a child copes. There is no right or wrong way to feel. Some days they may feel they are coping and other days they may feel completely lost and out of control. Support groups for parents and families are very useful. Siblings may also have feelings of anger and jealousy towards their brother or sister with cancer. Also, parents must take care of other siblings by keeping life as normal as they can, despite frequent hospital visits, seeing their brother or sister upset, in pain, or acting differently, as this can be very frightening to a child. Conclusively, we have to conclude that there is a life after cancer. Life is worth it. Never give up. Keep fighting.